I'm based on the Langford Campus at Bristol Veterinary School. I'm a specialist in veterinary cardiology, and my main area of interest is myxomatous mitral valve disease, which is the most common heart disease that we see in dogs. Unfortunately, it's a genetic problem. In certain breeds, it has a prevalence of over 99%. It's a degenerative problem. You develop a leak within the valve, and that creates a heart murmur, which is usually the first sign that there's a problem. It doesn't usually present until middle age and older age. I always say I'm going to cure mitral valve disease. Anyone who knows anything about mitral valve disease would say that that is an outrageously ambitious goal. But then, of course, we take each project as a building block towards that eventual goal. The Mitral Valve Clinic is a longitudinal cohort study, working with real clinical patients, but contributing to the knowledge base and research. We've recruited a total of 141 dogs, and we've been delighted by how supportive owners of the dogs are. Every 6 months, each dog comes to our research clinic. It's a great opportunity for our final year students. I have a list of questions that I ask every single time. They have a full physical examination. They have their blood pressure measured. We record an electrocardiogram. We perform an echocardiogram, so an ultrasound scan of their heart. And then we take blood for cardiac biomarkers. It's really important in this country that the blood sample should always be taken for the benefit of the patient. But owners very kindly give us permission to use any residual samples for research purposes. If we're able to get a free catch urine sample, we do a urine test. Any residual urine is stored. The dogs that are participating in the study, of course, benefit. All of these things have value in the clinical management and the monitoring of our patients, also in our research, so everything overlaps. Some of the dogs we've seen 8 times now, so we've got a lot of data. Some dogs develop the disease when they're very young and die at a young age. Some develop the disease when they're 11 or 12, and of course there's a spectrum all the way in between. The longitudinal study allows us to study those differences over time. And of course, a lot of it is going to be genetic, which is why we're looking into the genetics of the disease. So I think at the moment we're at a really exciting stage. I worked in primary care practice before I became a specialist. I saw an awful lot of dogs with mitral valve disease, but I always wanted to be able to do more. Looking at our patients as a whole population allows us to give improvements to clinical practice, which will benefit everyone's individual patients. So the impact is potentially enormous.